Good evening and welcome to the Adelaide Medical Students Society Health Forum. I'd like to begin by acknowledging the Kaurna people, the original custodians of the Adelaide Plains and the land on which we meet today. We recognise and respect their cultural heritage, beliefs and their relationship with the land. We acknowledge that they are of continuing importance to the Kaurna people living today. Thank you all for attending today. I'd especially like to thank both Minister Jack Snelling and Mr. Rob Lucas for agreeing to be part of this event. We are very grateful for their contributions. I thank our moderator and panel discussion chair for the evening, Dr. Andrew Perry. I thank our esteemed panel guests for the evening, Professor Justin Bilby, Dr. Patricia Montanaro, Dr. Peter Rishbeth, and Dr. Sophie Plagakis. I would also like to acknowledge and thank for their attendance distinguished guests from the university, the Vice-Chancellor, Professor Warren Bebbington, and the Head of School and the Dean of Medicine, Professor Alastair Burt. I also thank the other distinguished guests in the audience from the University of Adelaide. Finally, I'd like to thank our major partners, MIGA, PERCS, the AMSS, and SA Pathology. In particular, we thank SA Pathology, who are a long-standing and generous supporter of our education forums, and who have made tonight possible. So, it is my pleasure to announce to the stage, first, Minister Jack Snelling. Minister Jack Snelling holds office as the Minister for Health and Ageing, the Minister for Mental Health and Substance Abuse, the Minister for Defence Industries, and the Minister for Veterans Affairs. He was first appointed to the RAN Labour Ministry on the 25th of March 2010. Minister Snelling's other portfolio responsibilities have included Treasury, Workers' Rehabilitation, Employment, Training and Further Education, Science and Information Economy, and Road Safety. Minister Snelling was first elected to the South Australian Parliament in 1997 as a member for Playford. There he represented the people of Ingle Farm, Para Hills, Paraka and Walkley Heights. Minister Snelling is married to Lucia with 6 children: Molly, Helena, Frank, Joe, Peter and Thomas. He enjoys cooking, reading, playing chess with his children, listening to classical music and training at the Para Hills Amateur Boxing Club. Please join me in thanking Mr. Jackson. I'd also like to introduce Mr. Rob Lucas. Mr. Rob Lucas was appointed as the Minister for Education and Children's Services in 1993 and became the Treasurer in 1997. He was later also appointed Minister for Industry and Trade and the Minister for Government Enterprises. During the term of the former Liberal government, he also served as the leader of the government in the Legislative Council. Following the 2002 state election and up until April 2007, Mr. Lucas has served as the leader of the opposition in the Legislative Council, Shadow Treasurer, Shadow Minister for Industry and Trade, Economic Development, Science and Information Economy, and Police. Mr. Lucas is currently the Shadow Minister for Health, Ageing, Disabilities and Community Services in the Stephen Marshall State Liberal team. Throughout his parliamentary career, he's also been a member of various committees investigating issues affecting South Australians, such as internet and interactive home gambling, electricity industries in South Australia, the allegedly unlawful practices raised in the Auditor General's annual report, the Atkinson-Ashbourne-Clark affair, collection of property tax and state and local governments, Budget and Finance Committee, and Statutory Authorities Review Committee. Mr. Lucas and his wife Marie have 4 children. Please join me in thanking Mr. Lucas. Finally, I would like to introduce our moderator for the evening, Dr. Andrew Perry. Dr. Andrew Perry is a Senior Emergency Medicine Registrar at the Royal Adelaide Hospital Emergency Department, having graduated from the University of Adelaide Medical School in 2004. Dr. Perry was heavily involved in student advocacy through his time in medical school at both a local and national level, through such organisations as the Adelaide Medical Students Society, the Adelaide University Union, and the Australian Medical Students Association. Following his graduation, his commitment to representing the profession continued through his involvement with the Australian Medical Association, South Australian Medical Education and Training, the Australian Medical Council, and the Australasian College for Emergency Medicine. He's received numerous awards in recognition of his contributions, including the Adelaide Medical Students Society Patrons Plate, the inaugural life membership of the Australian Medical Students Association, the AMSS President's Award, the ACEM Trainee of the Year for South Australia, and Registrar Teacher of the Year from the University of Adelaide Medical School. Please join me in thanking Dr. Andrew Perry.
Thank you, Kartik. My role tonight is to be the chair and moderator of tonight's first debate and then subsequent panel session. Firstly, I'd like to go through the rules of the debate. Each speaker will receive 10 minutes for an initial presentation. The initial presentations from both speakers must address at least the three following topics. A, should South Australia ensure all locally trained medical graduates have internship positions and subsequent training positions in South Australia? B, the impact of the new Royal Adelaide Hospital on healthcare delivery in SA, and C, the future of mental health services in South Australia, particularly for the 13 to 25-year-old age group. Perhaps they'll even venture beyond these limits. In terms of the order of speakers, in keeping with tradition, the person that is in government will speak first, the Honourable Jack Snelling, and this will be subsequently followed by the Honourable Rob Lucas. Each speaker subsequent to the initial presentation will receive 5 minutes for rebuttal. A time warning will be sounded when 1 minute is remaining. Now, notes are permitted, although I see Mr. Lucas here is backing himself. Unlike the Rudd versus Abbott debates, there's going to be no penalties for having notes. But unlike those debates, there will be no worm, although you are free to participate via the hotline that we've got in terms of questions. Can I remind all of you that subsequent to the debate and the rebuttal taking place, we will ask you to stay in your seats and we will subsequently set up for the panel session. So without further ado, I'd like to invite Minister Snelling to the stage.
Thank you very much, Dr. Perry. I should acknowledge Dr. Perry for saving the life of my Chief of Staff. A couple of months ago, he had an anaphylactic attack and presented to the emergency department in a very bad way, and Dr. Perry intervened, much to the disappointment of some of the staff in my office. We had marked his records not for resuscitation, but Dr. Perry obviously missed that, and so I'm still stuck with Peter. Good evening, and among the things I've been asked to address are internships for locally trained medical graduates, and I'd like to open by giving you some assurance on this matter. While increases in graduates will present challenges, we're working closely with the federal government to ensure we can continue to offer all graduates the necessary experience of an internship. We've always been able to provide internships for our local graduates, and we will continue to do so. Now, it's particularly good to be able to address you, our future doctors, because you'll be dealing with the challenges our health system faces. There will be many, and we must be prepared. I've always been fascinated by the science of health and these kinds of questions. And I was recently reading William Bynum's fascinating history of medicine, and I was inspired by the story of the fight against cholera. Beginning in Calcutta, a particularly severe epidemic swept through the Middle East and Europe, arriving in England in late 1831. In those days, there was disagreement between miasmists, who believed diseases were airborne, and contagionists, who thought that they spread through human contact. When cholera swept through Persian villages, guns were fired to try to frighten the infection away. In Germany, beggars who claimed to have the infection were paid to leave town. People fled to the country, spreading the infection still further. In England, therapies included rubbing the body with mustard, high doses of opium, tobacco smoke enemas, and, worst of all, oilcloth plugs forced into the rectum to prevent diarrhoea. Now, against this backdrop of quackery, John Snow worked methodically to find the source of the epidemic. With the help of a local clergyman, Snow plotted every house in the Soho area where a cholera case had occurred. At the centre of his markings, he found the Broad Street water pump. All of the victims had drawn water from this site, and Snow found an open sewer running into the water supply. He removed the pump handle, and further cases were prevented. Can you imagine being a doctor at that time in history where everything changes? And citizens of the future might view you in a similar way. The world is changing fast. The internet has given us untold access to medical information, but it's also brought self-diagnosis. Advances in medical technology are making our sci-fi look bland and slow, and our ageing demographic must bring profound change to the practice of medicine. My brother Tom is a paediatrician and a medical researcher. He was awarded an inaugural Frank Fenner Fellowship by the NHMRC. Two of my uncles and two cousins are doctors, so as the Health Minister, I'm a bit of the black sheep of the family. Long before I became Health Minister, I understood how dramatically the government could get healthcare wrong, but I also understood the good that government can do. And since I became Minister in January, I've visited all of our metropolitan hospitals and most of our country hospitals, talking with doctors, nurses and patients. I've seen open heart surgery, spent a night on the road with our AMBOs and witnessed a patient having a psychotic episode in an ED. I've met burn survivors and patients coping with life-changing injuries. I've seen the wonders of PillCam and interventional cardiology. I've talked with the parents of babies with congenital heart disease and the researchers looking to cure this. The gravity and scope of the health portfolio certainly teaches humility. When the government came to office in 2002, our hospitals were understaffed and badly in need of investment. Our wards were dilapidated and in urgent need of repair. There were wide shortages of doctors and nurses. Staff would run off their feet, and South Australia was performing poorly in crucial areas. Labor promised to do better. We invested in doctors, nurses, midwives and health professionals. We invested in health programs. We invested in our hospitals. South Australia now has the highest number of nurses as a percentage of the population of any state, the highest number of salaried medical officers and the highest number of hospital beds. During this time, we've upgraded all our metropolitan hospitals, work that includes more than doubling the size of the Lyell McEwen Hospital. We've built and are building a new regional cancer centre in Whyalla and upgraded regional hospitals in Noarlunga, Berry, Ceduna, Port Lincoln and Mount Gambier. At the new Royal Adelaide Hospital, up to 17,000 more patients will be seen every year. The hospital has 5 extra theatres and will provide 120 extra beds. This includes a 40% increase in intensive care unit beds. The new RAS design includes single bed rooms with en-suites, and this will improve infection control and reduce the risk of medication errors. A flexible floor plate can adapt to future changes without costly rebuilds, extensions or refurbishment. Now, I'm particularly excited about South Australia's future in research. With the federal government and other partners, we've invested in a cancer centre, a medical health and research institute, gene therapy laboratories and pulmonary medical clinics. Although South Australia has a proud history in health and medical research, the state government noticed that the proportion of research funding coming into South Australia had been declining in comparison to other Australian states. And so in response, we decided to establish SAMRI in 2008, and the federal government allocated $200 million to build the research centre. SAMRI will greatly increase the nation's capacity for leading scientific research by assembling a team of more than 600 outstanding researchers who work together in the search for better treatments and cures for some of the world's most challenging diseases. Mental health is a priority for the government, and since the Social Inclusion Board's 2007 Stepping Up report, the government's allocated more than $330 million to improve services and infrastructure. The investment will increase the capacity of South Australia's mental health system to 615 beds and places by 2014-15, an increase of 102 beds and places since 2007. We've redeveloped the Glenside campus and are creating 6 community mental health centres across Adelaide, the first of which I opened in Salisbury earlier this year. We know that 75% of mental illness first occurs before the age of 25, and this makes early intervention and treatment critical. A new model of care for child and adolescent mental health services is being created, which will provide care for 0 to 15-year-olds and a new youth mental health system of care for 16 to 24-year-olds. CAMS was treating a high number of children until the age of 18, who then dropped off the radar and didn't access services again until their mid to late 20s. This new model of care will go some way to ensuring that people continue to get the care they need as they become adults. Our long-term investment in healthcare has produced results. The latest national reports show that South Australia is continuing to lead the nation for emergency department and elective surgery waiting times. South Australia has ranked first nationally for emergency department median waiting times with 15 minutes in 2011-12, which is 6 minutes faster than the national average. Our emergency departments also ranked equal first nationally for the number of patients seen on time in 2011-12. South Australia's elective surgery waiting times have also improved. While national averages have stayed relatively unchanged, South Australia's waiting times have shortened since 2007-8. Over the next 30 to 40 years that most of you will be practising, healthcare will change more profoundly than it has in the last 50 years. People in the future may view what you do now as akin to John Snow's work with cholera in the 19th century. What scientific revolutions, what paradigm shifts will you witness? The potential of new technology appears limitless, as does its cost. Our ageing demographic is going to present enormous challenges. Whereas a decade ago, most of you will have expected to spend your careers in perhaps an acute hospital setting, in the future there'll be a greater emphasis on practice in community settings, keeping people out of hospital. This government's always believed in investing in our healthcare system and will continue to do so. But what we've done over the past 11 years and what's being achieved is the best kind of eloquence. South Australia has the best health system in the country, and we need to keep it that way. Certainly the sort of investments the government has made and are going to help meet those challenges. Reforms that we're making, particularly in mental health, are going to be even more critical to meeting those challenges. Thank you very much.
Thank you, Minister Snelling, for putting the case for the government. Every time I receive an email from you now in my health account, I'll always think of you as the black sheep. It's an interesting way of looking at your achievements. I would now like to invite the Honourable Rob Lucas to put the case forward for the opposition.
Thanks, Andrew, Karthik, Jack, distinguished guests, ladies and gentlemen. Thank you firstly, or congratulations firstly to the Adelaide Medical Students Society for organising the event tonight. Jack and I were chatting out the back, and Jack remarked that it was a long time since he could recall seeing so many people coming to listen to two Polly speak, and I said, I suspect it's got more to do with the free food and drink than it's got to do with the quality that both Jack and I will be offering this evening. But nevertheless, we're grateful for the opportunity, and we look forward to the exchanges this evening. I've been asked to address the three issues, as Andrew indicated, and unlike a Liberal politician, I'm going to try and answer the questions, and I'll work my way through them. The first one was in relation to internship positions for medical graduates. I share many of the statements that Jack made. Certainly from our viewpoint, we understand that this particular issue has caused some stress and uncertainty for medical students throughout Australia. Certainly there is a risk of driving graduates overseas to complete their qualification when we know that their skills are sorely needed in Australia. We as a nation, we as taxpayers have invested a lot in the clinical training, as you have, in terms of your investment and your effort in your studies, and certainly we are as one with the government in wanting to ensure that your services are employed here in South Australia and Australia. I do want to read from, given that we are coming up to a federal election, the policy position enunciated during the campaign by Tony Abbott and Peter Dutton. And if I can read that as the Coalition's federal commitment in relation to this issue. Accordingly, a coalition government will commit $40 million over the forward estimates to support up to 100 additional intern places each year in private hospitals and non-traditional settings during this period of growth in student numbers. This will provide more certainty for students and alleviate pressure on public hospitals for training. Priority will be given to positions and rotations outside major metropolitan centres to bolster the medical workforce in rural and regional areas. As part of this initiative, the Coalition will also work with the states and territories, universities, private hospitals and other relevant stakeholders to improve national coordination of intern positions. This includes prioritising a coordinated application and allocation system for intern places. As a state shadow Minister for Health, certainly, as I understand it, all of the state ministers and shadow ministers are supporting the Coalition's position in relation to that policy announcement. The second issue I was asked to address was the NRA, the New Royal Adelaide Hospital. Certainly from our viewpoint, and I was asked to address the issue of its impact on the health system. Certainly from our viewpoint, a community viewpoint, we would hope that as a state, having invested more than $2 billion in those facilities, we hope that that particular facility, when it's up and running sometime in 2016, will capitalise on the opportunities which will surely be there for improvements in the quality of services that can be provided out of the Royal Adelaide Hospital site. However, I think we all understand that it's one thing to build great new buildings. The second issue is obviously the critical issue of the ongoing impact of operating costs and recurrent costs in terms of what you can actually do with the new facility, the new building. And clearly the impact of the New Royal Adelaide, the NRA, will be felt right across the health sector. I've referred to the NRA as something akin to a fiscal vacuum cleaner. It'll be sucking virtually every last health dollar out of our health system from 2016 onwards. The cost will be, from 2016 onwards, some $400 million a year for 30 years, just for the non-clinical services to be provided from the site. That, of course, doesn't include the costs of doctors, nurses and other staff as well. In addition to that, and there will clearly be an impact felt from 2016 onwards, whoever's fortunate enough to be elected after March 2014, they will inherit that impact on their budget position. In the period leading up to 2016, there's also another impact. $244 million will have to be found out of our forward estimates with an impact on the capital works for state-imposed costs or incurred costs on the system. And we've already seen in our capital works budget in other areas significant delays in other capital works budgets. If you look at the 2011-12 budget documents and compare them with the most recent one, redevelopments like the James Nash redevelopment, the delay in the end time for that has now been put out by 30 months. The Women's and Children's Hospital development has been delayed by 24 months in terms of its end time, and the Mental Health Early Intervention Centre proposals have been delayed or put out or deferred for 24 months as well. There are a number of other significant impacts that whoever's elected after 2014 is going to have to consider. A number of issues have not been included or have been costed in terms of the upfront costs for the NRA. There are significant impacts on clinical research, which are already being discussed by the medical research community and those in the hospitals. The amount of space in the NRA available for clinical research is significantly less than what was asked for, what was required, and what is currently available in the existing building. There are significant additional issues in relation to pathology, in relation to what can be provided at the NRA site and what will need to be continued to be provided from Frome Road, and the issues of getting from one site to the other. There are very significant issues in relation to the dental hospital and the dental school, which have not been costed as a part of this particular proposal. And I understand recent announcements from SA Health would indicate that the proposal is to cut by 101 the number of dental chairs from 138 down to 37 as part of the latest thinking in relation to that. The University of Adelaide has advised me that that does threaten the future of the dental school here in Adelaide. There are issues in relation to the chest clinic, which is conveniently at the moment across the road from the existing Royal Adelaide Hospital. They tell me that their understanding is they're going to stay where they are. The convenience of being nearby to staff and to patients, the issues of how they manage their services will be issues for whoever's elected after March 2014. So I just raise those as a range of issues that, in terms of what the impact of the NRA will be on the health system post-2016, it will be significant. As I said, we certainly hope, as I'm sure the government does, that the quality of the services delivered through the hospital will improve what we can provide through our premier hospital in South Australia and in Adelaide. But the issue will be what will be the impacts to be felt across the board in the other areas of the health system. I've canvassed just 4 or 5 of those. There are certainly many others that are already being raised with me in terms of what a future government, what future ministers will need to consider in relation to the impact of the NRA. The third issue, the final issue I was asked to address specifically, was the issue of mental health. The Minister summarised some of the recent reviews and changes that SA Health has implemented in relation to CAMS and his outline of the proposals in relation to youth-related services as well. Whilst I'm not specifically the spokesperson for mental health, Duncan McFetridge is. Our view, I'm advised, is that we're generally supportive of the direction that the government is heading in relation to these issues. Time will tell. It's a difficult area. We understand that as much as I'm sure the Minister and the government does, and we'll be interested, obviously, to observe the impact of the changes that have been recently announced by the government and the department in relation to these particular issues. As I said, whilst I'm not the spokesperson in the area, I'd offer one personal, I guess, observation, and that I have some concern at the reduction in the number of acute beds that the government and SA Health have implemented over a period of time. I know the government, in part, I suspect, is responding to some community concern about that by saying they'll pause for a period, but I think the government's intention is clear in terms of their future directions. Certainly, as a potential future minister, that's an area that I have reservations about in terms of direction. So if I can summarise, and hopefully before the hook comes out and drags me across, I'm delighted to have been asked to be here. I look forward now to I think we have a further interaction, as I understand it, under the rules of engagement, and then the panel session later on. Thank you.
Thank you, Mr Lucas. You've certainly posed as many questions as you've provided answers on what a future Liberal government might do in these areas. Fortunately, we've factored that into the format for tonight, and Minister Snelling will now have 5 minutes to provide his replies to any points that have been raised in Mr Lucas's speech. Minister Snelling.
Thank you very much, and thank you to Rob. Look, Rob certainly has, I guess, a shopping list of things in the health portfolio that are to criticise and to complain about. He's got a bit of a shopping list of gripes. And certainly if the government had done nothing over the last 10 years, there really wouldn't be anything for Rob to criticise. But everything that Rob has picked up on are because of reforms the government is making. When we came into office, we quickly realised that there were two things that were necessary. Firstly, the delivery of health services had to change, that we couldn't just keep on doing what we were doing with the changing demographic, the increasing demand for healthcare, that the whole system, the way we deliver healthcare would require significant change. And secondly, if that was to happen, it also would require a significant investment. Now, of course, if we'd sat and done nothing over the last 10 years, well then there wouldn't be anything to complain about. It's very easy to complain about change, to complain about reform. This government grasped the nettle very early in office under my predecessor, John Hill, and realised that we needed to reform the health system. We needed to look at new and better ways of doing things. Now, I guess there are two centrepieces, I think, of the reforms in terms of our investment that we've made. One is EPAS, the new electronic patient administration system, whereby patient records will be able to access at the bedside. The patient will be able to, the doctor or nurse who's treating the patient will be able to access that patient's notes. Ultimately, that system will be available certainly across the metropolitan health network, at least in the first instance, and so regardless of which hospital you present at, you'll be able to access, the clinicians who are treating you will be able to access those patient records. Revolutionary. Secondly, the new Royal Adelaide Hospital, which of course the opposition campaigned very strongly against in favour of a rebuild of the existing hospital. The government made its case very strongly on why a new hospital had to be built on a greenfield site. We couldn't just, to deliver healthcare in a new way, we wouldn't be able to do that by a patch-up job on a hospital that had been there for over 100 years and components of which were old and dated. Really, only a greenfields build on a brand new site was going to deliver the sort of hospital that we needed to deliver a new way of patient care. And so what we will see in the new hospital is patient-centred care, patients being able to access or having access to single rooms, and the hospital revolving around the patient rather than a patient being wheeled around from one corner of the hospital on a gurney to the other corner of the hospital for various treatments or diagnoses. Those treatments, as much as possible, will come to the patient in their own room. This is a revolutionary way of delivering healthcare in what will be the most advanced hospital, one of the most advanced hospitals, if not the most advanced hospital in the world. And I hope as many of you as possible have an opportunity to work in those hospitals. I make no apologies. Of course, any such transformative delivery of healthcare is going to have its teething problems. There's always going to be, if you undertake any sort of revolutionary change, there are always going to be difficulties, hiccups along the way. But what we're headed towards is a brand new way of delivering healthcare, which will put patients at the centre. And I think as clinicians, when you're working in the Royal Adelaide Hospital and the other hospitals where we change the way of delivering healthcare, you'll find that much more rewarding. Where Rob sees only costs, I see investment. Investment in the future of healthcare in South Australia. Investment in the sort of conditions we expect our clinicians to work in. Investment in the sort of healthcare which will be delivered to patients. Firstly, to ensure that the experience patients have when they go to hospital is far better than it is at the moment. And secondly, a health system which is more efficient, where there's the capacity there to deal with the increased demand and that we're going to see as our population ages. As a nurse said to me down at the Noarlunga Hospital the other day as we unrolled EPAS, which has been operating for a couple of weeks now at the Noarlunga Hospital, she said, "This is the biggest change I will ever be involved in. The biggest change I will ever be involved in." Out there in the hospitals, our nurses and doctors who are seeing the changes that are being made are welcoming it and embracing it, and I think that is a fantastic thing. Just very quickly, is that 5 minutes or 4? Just very quickly on mental health. Look, the government, through stepping up, realised that if we were to better address mental health, to do it more efficiently with better outcomes for patients, More mental health care had to be devolved into the community. Mental health patients had to be better managed. Their chronic diseases have to be better managed in the hospitals so they're not presenting into our emergency departments. It's not good enough to allow people's illnesses to escalate to where they require hospitalisation. We need to treat these people, better manage their conditions out in the community, and that's why the government, through implementing the Stepping Up reforms, has made a significant investment in subacute and community-based mental health care. Thank you, Andrew.
Thank you, Mr Snelling, for that passionate rebuttal. I would now like to invite Mr Rob Lucas up to stage for his 5-minute reply.
It's a bit unusual. I get the last word here, Jack. So, a couple of issues. In relation to IT, I'm delighted that Jack's raised the issue of EPAS and IT, because one of the issues in terms of future governance of health has to be that we're charged with the responsibility of managing $5 billion-ish of taxpayers' money. We're over 30% of the state's budget, and I make no excuses for putting a position, not just to you, but to anyone who's prepared to listen, that we need to spend our money and spend it wisely, because if we spend it wisely, we'll be able to do lots of the other things which inevitably governments and ministers say they don't have the money for and they have to cut, such as primary-based healthcare programs as a result of the Monaghan review and other issues like that. But in terms of IT, let me just give 2 examples here. The Oracle system, which is managed by the government in health, its net cost, its cost was meant to be just over $20 million. Its net impact on the budget, the Auditor General has just reported, was 3 times that at just over $60 million. A blowout of almost $40 million on a $20 million cost. EPAS that Jack has spoken eloquently about was originally estimated to be $408 million. They forgot to put the CPI inflator in terms of the cost, so that's now $422 million. It was meant to be concluded by June of next year. The latest estimate is, if we're lucky, it'll be mid to late 2015 before it's implemented. It is a financial disaster in the making of a similar nature to the problems with Oracle. And one of the doozies that the lucky Health Minister after March 2014 will inherit will be how to manage the implementation within the budget, or something close to the budget, of EPAS. No disagreement. It's a great idea, it's a great scheme, and we hope it works. But ultimately, you, the taxpayers, when you are, we hope, well-paid, well-employed medical graduates, you, the taxpayers, rely on people like us and the people in our departments to spend the money wisely. And mark my words that $422 million will not be the final cost of EPAS when all is revealed after March next year. Jack also spoke about the reforms that have been implemented by his predecessor and himself as part of the government as well. I do want to touch on briefly one of those, and that is the whole issue of governance, which I think is critical. We have in South Australia, in my view, one of the 2 most centralised bureaucracies in Australia. That is too much, and this was a conscious decision by the government. I think Jack will acknowledge that. It was a conscious decision by the government in the abolition of the boards and the regional networks to centralise decision-making in headquarters and with the Minister for Health. And what we have as a result of that is a good example of health constipation, where everything is just stuck waiting for a decision with the Minister, with the Chief Executive and with the people in at central headquarters. When you look at all of the other systems in terms of where they're heading, and the other health systems in terms of where they're heading, they are looking at a sensible sharing of power between people closer to the delivery of the services as opposed to those who are the most distant from the delivery of those particular services. And certainly, as I've canvassed earlier in various other debates with Jack and elsewhere, the direction that we'll be heading will be to follow that sort of general direction to try and ensure that some of these decisions are being taken by people who are closer to where the services are being delivered, to people who know a bit more about what's being delivered at that particular local level, in a sensible sharing of responsibility between them, the Minister and the executives in at headquarters. So we acknowledge the reforms, but Jack and his predecessor have a view of centralisation and control, which, as I said, has led to, in our view, a constipated decision-making process. We believe in a more decentralised model, and certainly that'll be the general direction in which we would head.
Thank you, Mr Lucas, for that rebuttal, including that colourful medical analogy. This brings a conclusion to the health debate, but the night is certainly not over yet. We will be having a short break, in which time we would ask you to stay in your seats, or at least stay in the hall, and during that time we're going to set up for the panel debate. So if I can ask you once more to join with me in thanking the Minister and the Shadow Minister for their contribution.